Summer is nearly here, bringing sun and fun, but you need to be prepared.
Our shoe wear exists for different purposes. If you are going to a farmer's market or a festival for 8 to 10 hours, walking around in a hard substrate, you need to have a shoe that will provide stability, cushion, and shock absorption.
Because preparedness can lead to prevention.
One really intense sunburn, if you're a child and you have that can double your lifetime risk of melanoma because some of those damaged cells survive. So over time, they're damaged, they have this mutation, and that can eventually lead to skin cancer.
Discover Summertime Preparedness and Prevention inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. Summertime seems to take forever to arrive and is over in the blink of an eye. That's why we must be prepared to take preventative measures in protecting ourselves while we enjoy the sun and fun this summer. So, we've invited a couple of experts to help us with that, beginning with Dr. Brian Fisher, a podiatrist and foot and ankle surgeon at Froedtert and the Medical College of Wisconsin, who tells us summertime can present challenges toward our foot health.
One of the things about living in the Midwest is you have 4 very distinct seasons with 4 very different sets of potential risks. So summer will give you certain conditions that are going to flare up more.
Is summertime more challenging for maintaining foot health?
You see a lot more sports med type injuries, and I think you see a lot more foreign body traumatic type things in the summertime.
He adds that as a podiatrist, during the summertime,
we tend to be a little bit busier with people that are coming in with newer complaints, right? So newer onset pain and discomfort. I think there's an uptake of that in the summer months.
But why summer? Well, Dr. Fisher says a lot of it has to do with the fact that
we are kind of cooped up for so long. When you get those nice days more consistently, people get out and they do a lot more.
What summertime activities lead to foot-related injuries and conditions he sees?
They're doing a lot more yard work, getting out and doing more exercise. This time of the year, you start to see people outside doing a lot more stuff.
Stuff like
soccer, baseball, softball, pickleball, just a general increase in activity that we have. You know, we have a solid 4 to 5 months to get as much outdoor time as we can.
Something else leading to summertime foot issues in our area.
You know, a very unique thing I think that presents in the summertime is festival season, especially in Milwaukee. There are a lot of people who are out walking for 10, 12 hours during a day, and that can just create these situations that some of these conditions can flare up at a higher frequency than what they do at other times of the year.
Next, Dr. Fisher shares some specific conditions he treats, especially during summer, beginning with plantar fasciitis.
Plantar fasciitis, I do see this time of the year a huge uptake in it. You have to think of it like the suspension system for your foot. So it kind of mimics your arch shape. It is a very robust ligament that originates from your heel, and then it fans out and kind of inserts into the ball of your foot. And it really is trying to maintain your arch.
However, with increased levels of activity in summertime,
you're putting a lot of stress on that area and the symptoms start to flare up.
What are common symptoms of plantar fasciitis?
The most common thing is going to be pain in the bottom and inside part of your heel, kind of where the arch and the heel meet up. And it hurts the first couple of steps out of bed in the morning. Sometimes if you've been active all day, it doesn't really bother you, but then you sit down for a period of time and then kind of reinitiate activity, you end up getting this really sharp pain on the bottom of your foot.
What are common treatments for plantar fasciitis?
The term fasciitis just means it's inflammation of the ligament, the fascia itself. So the way we address things in the clinic is from your bone anatomy and then anti-inflammatory treatments.
In first focusing on the anatomy and mechanics of your foot, treatments can include home therapy,
a combination of stretching exercises, deep tissue massage, taking a frozen water bottle and rolling that from your heel to the ball of the foot will help improve the mechanics of your foot and ankle and also decrease the stress across your plantar fascia.
Treatment might also involve use of therapeutic tools.
Changing how your foot interacts with the ground. We address things with an orthotic that goes into a shoe that will provide a lot of nice arch support. So sometimes just getting people plugged in with good supportive shoes in combination with those inserts is great.
Then, for pharmacological treatments of plantar fasciitis,
there's really three focuses. The oral use of nonsteroidal anti-inflammatory medications, or NSAIDs, like ibuprofen. For more consistent pain, we'll do some dosing of prednisone or steroids, or sometimes even a cortisone injection, depending on the severity.
Another common summertime foot injury, stress fractures.
A stress fracture is susceptible to occurring any time that somebody has a dramatic uptake in activity. So even a day at a festival with a shoe wear that's maybe not quite as supportive increases the stress across your foot.
How does a stress fracture develop?
The bone anatomy leads to certain areas of the foot to have more stress compared to others. Acute uptake in activity level can cause there to be an imbalance in how you're building up the bone versus how the bones are being broken down by chronic stress.
Dr. Fisher further explains,
on a day-by-day basis, there is really good balance of your body remodeling the bones. There's stress that breaks down the bone a little bit, and then your body is building up. So it's remodeling constantly.
But in the case of a stress fracture,
the area gets a little bit too much broken down, and the bone starts to soften. That can actually lead to a stress fracture. It's a byproduct of bone breakdown process overwhelming bone buildup process.
When it comes to treating a stress fracture,
it's very tough, especially when people present with symptoms over a relatively short time frame. And a lot of times you can get an x-ray, and the x-ray can be completely normal. So that bone break doesn't necessarily show up.
Still, even in the absence of seeing the stress fracture,
even though the x-ray doesn't necessarily show that there is that break, we still treat it like it is one. And a lot of times we get follow-up imaging, and now you actually see some of those changes within the bone that verify your diagnosis.
Which, for some patients, could mean
the mobilization needs to be done. There are times where you're able to ambulate, but other times where you need to be non-weight-bearing for a couple of weeks. And what you'll find is the symptoms dramatically get better over a span of about 4 to 6 weeks before a lot of times getting people back to their baseline.
Also, during summertime, Dr. Fisher sees lots of sprained ankles.
You get back out into your backyard and there's a lot of undulations in the grass. So you can be walking and you kind of step in a little divot and your ankle either rolls inward or outward,
resulting in a nasty old sprained ankle.
A stretching injury of ligaments. You have 3 ligaments on the outside of the ankle. You have 5 ligaments on the inside of the ankle. And more common than not, it's what we would call a lateral ankle sprain, which is on the outer portion of the ankle. The foot gets caught and kind of rolls inward on the ankle itself.
Although, he says they can range in severity.
Mild being more of a stretching injury, but the ligament contact actually remains intact. Then you have a moderate ankle sprain where you start to get some partial thickness tearing, and then a severe ankle sprain has to do with there being a complete tear or a rupture of those ligament structures. And what that does is it creates a lot of instability, making it difficult to ambulate.
The level of severity will dictate treatment options.
Depending on the severity, PRICE, which is protect, rest, ice, compression, and elevation, can be a really good method for the first couple of days to get the swelling down, get the pain under control, and allow the body to start going through its natural inflammatory process.
While a moderate to severe ankle sprain might mean
we have to immobilize somebody in a boot because their ankle feels so unstable or because the pain or discomfort is severe. Sometimes it's being in crutches, depending on the severity of the injury.
How do I know if an ankle sprain needs to be looked at? Dr. Fisher says,
it should never be a normal thing where you can't put weight on your foot. If you can't put full weight on your foot, you should go get it checked out.
oh, and for you tough guys with the just rub some dirt on it mentality,
There was a study that was done. What percentage of people get better with ankle sprains? They looked at how did these people do a year out from the injury. Up to 80% of the individuals in this study did well.
well, that's pretty good, right? Well,
You can say, wow, that's great. But that also means that there were 20% of people that 1 year out were still dealing with some sort of debilitation, pain, or feelings of instability where you're not quite steady on your ankle.
so still want to just rub some dirt on it?
Yeah, proverbially rub some dirt in it and you'll be fine. In the very short term, it may get better, but that lingering pain and discomfort can be a sign of something more malicious going on.
Now, many foot conditions, especially during summer, are directly related to our choice of footwear, and Dr. Fisher identifies some of the main culprits.
The idea that you can take a shoe from the heel of the shoe to the toe and be able to kind of bend it where, they can end up hitting each other, that flexibility of the shoe wear becomes a big issue. So the lightweight type shoes really lack a lot of support.
Which doesn't mean such shoes are inherently bad.
They're great if you're going to be at the pool all day and you're just going to kind of be going from the pool to a chair back and forth a little bit.
But wearing footwear like that, especially on hard surfaces,
That is not going to be good for you to be walking around all day doing yard work or going to a festival or something like that, because we're walking around on these hard substrate surfaces, concrete, blacktop. The shoe that provides no cushion or no support can create a lot of issues.
another type of summertime footwear that can sometimes be problematic is
When you have shoes that don't have a back to them, because when you have nothing that is grabbing your heel, the tendency is that your foot wants to slip out of that shoe wear.
and what's our natural reaction when that happens?
We actually try to curl our toes and try to grip the sandals that we're in to prevent our foot from slipping out of those. So you can get worsening hammer toe deformities that then create more of that pressure in the ball of the foot. So shoes that are open back, and then shoes in general that are highly flexible, have very low support and protection as well.
As a foot health expert, what are his recommendations for summertime footwear choices?
In general, our shoe wear exists for different purposes. You're not going to wear the boots that you wear when you're shoveling snow in the winter to go to the beach in the summer. So there is a lot of science and there is a lot of technology that goes into activity-specific shoe wear.
Point being, depending on what your plans are on any given day,
If you are going to be in the yard and you're going to be doing stuff, your shoes need to have the function of providing stability so that if you do walk on uneven ground, the shoe provides stability. It also needs to be protecting you, having a little bit of a thicker sole to the shoe in case you step on something sharp that it's not turning into a puncture wound.
what about for hard surfaces?
If you are going to be going to a farmer's market or a festival for 8 to 10 hours, walking around in a hard substrate, you need to have a shoe that will provide stability, cushion, and shock absorption.
What about going around barefoot? Is this inherently unsafe? Perhaps surprisingly,
I think there is a huge benefit to doing certain activities barefoot. There are times where we should be functioning without shoes that constrain our movement. I think it's good. I think it allows the intrinsic muscles within your feet to develop.
but when you are barefoot, watch where you step.
One thing that we see a lot of is foreign bodies, right? A little bit of a puncture wound, a thorn, pieces of glass, broken bottles, all that kind of stuff that can get embedded into a foot and can cause really bad issues. Anytime you are barefoot, you are susceptible to having something happen. So if you do feel that little poke, get it checked out, just because it can really snowball into something more problematic.
As we head into summer, Dr. Fisher says, do your feet a few favors.
Number one, activity-specific shoe wear is really important. You know what you're going to be doing that day. Make sure that you're using shoe wear that is appropriate. Don't get caught doing something and you think to yourself, oh, I wish I would have worn this pair of shoes.
Number 2,
taking a look at all of your shoes is important as well, and evaluate the shoes. Take a couple minutes to just look at them and see if they're really worn. And if they are, it's probably time for an upgrade.
And number 3,
be slow and be consistent with your uptake and activity. We learned to walk before we learned to jog. We learned to jog before we run, and we need to learn to run before we sprint.
because this summer he wants us to be healthy, head to toe.
What's today going to bring? And having a shoe that does provide the appropriate protection is critical.
Our skin is our body's largest organ, covering an average of about 20 square feet of surface area and accounting for more than 15% of our body mass. As an external organ, our skin provides protection of our internal organs, among other vital functions. But our skin also needs protection of its own. To discover how to protect our skin, we get expert insights from Dr. Shola Vaughn, Associate Professor of Dermatology at the Medical College of Wisconsin. Dr. Vaughn tells us summertime presents challenges for maintaining healthy skin, but so do other seasons.
Many skin conditions have a seasonality. When we think of eczema or psoriasis, those are two of the most common skin conditions, and they both tend to flare in winter. There are things about summer that make it more challenging for skin, but thinking about just general skincare, the seasons all have their challenges. In winter, we're battling dryness. Summer, we're battling sweat and sun protection.
One thing challenging the health of our skin, especially during summer, are the sun's ultraviolet rays. But what do we know about UV rays and their potential impact on our skin?
We hear a lot about UV, and in fact, people maybe have an understanding of it, but not in depth.
So, Dr. Vaughn paints a simple, colorful picture of it for us.
Light and energy come from the sun. All of that light and energy is on the electromagnetic spectrum. And that spectrum includes visible light, so that's the light that we see, the light that if you filter it through a prism, you get a rainbow. And then beyond what we can see, on the red side, you have infrared light. And then beyond the purple or the violet side is ultraviolet rays, or UV.
She simplifies it further, explaining there are 3 types of UV light rays. First, there's
UVA, we usually think of as aging, A for aging. It's the most common type, and it does penetrate through clouds. So even on a cloudy day, you can still be getting that damaging, aging UV light.
Then there's
UVB is for burns. That can cause a lot of damage to the skin cell's DNA. But ironically, UVB causes more aging than UVA does. So these names aren't perfect, but they're just kind of easy ways to remember.
And the third type
is UVC. You don't hear about that one because it gets absorbed by our ozone layer.
Are UV rays inherently dangerous or potentially damaging to our skin?
Well, I can't say that because we use UVB. We call it narrowband UVB to treat certain skin disorders like psoriasis, like eczema. So UV is not inherently damaging. The problem is the UV that we get from the sun hasn't been filtered into this medical grade UV like our medical therapies have.
Also, the sun's UV rays provide us with vitamin D, although she says this might be a bit misleading.
People started to say we need a little bit of sunlight, but the American Academy of Dermatology kind of pushed back on that and said, no, the best way to get vitamin D is from food or supplements, not sun exposure. And in fact, we need very little UVB. So, this idea that, we need some UVB, it's good for us, is probably not true. And so, dermatology's viewpoint on this is that all UV is potentially dangerous. So in a sense, yes, UV is generally damaging. If we had to be binary about it, then I would say yes, it's damaging.
We asked Dr. Vaughn for her expert insights on some specific skin conditions caused by UV rays, beginning with sunburn.
Oof, as a dermatologist, it just burns my heart. It hurts. I can see it hurts them, and that makes it hurt me more. Oh, I hate sunburns so badly.
She explains what happens to our skin when we experience sunburn.
Sunburn is a radiation burn. It's so dangerous to the DNA in the cells because the UV is basically breaking those DNA structures apart. And so then the cells, because they've been so damaged, they die. And that's why you get the peeling. The peeling is just your body saying, okay, these skin cells, we need to get rid of them. So that's why they peel off.
Leaving your body to repair what it can.
And so that's your body's normal, natural inflammatory process coming in to kind of clean up. That's where you get the redness, the inflammation, the pain of a sunburn is because your body's trying to fix all that damage.
And that's just the short-term damage. But the long-term problem is
some of those damaged cells survive. So over time, they're damaged, they have this mutation, they're still regenerating, they're still dividing and acquiring these mutations over time, and that can eventually lead to skin cancer.
Which we'll learn about later. First, Dr. Vaughn has more on how serious sunburn can be toward maintaining healthy skin.
Sunburn is the antithesis of healthy skin. It's skin that has been severely damaged. And we know that sunburns that you had younger are more impactful. There's statistics that having a handful of blistering sunburns when you're under 18, your melanoma risk goes up 75 to 80%. That is what we know now. The sun damage you have as a kid is much worse.
Apart from UV rays, there are other factors that can contribute to getting sunburn.
People who have lighter complexions are more likely to get burned. And the reason for that is because the melanin in skin of color does provide some sun protection. So certainly if you have darker skin, you are slightly more protected, but that is often not enough. So even people of color do need sun protection.
Even taking certain medications can increase your risk.
Sometimes it's a photosensitivity. There's some drugs commonly causing phototoxicity, and then there's also photoallergy.
Also, being mindful of where you'll be in the sun, including places like
ski hills. People didn't think that they could get a sunburn when they were skiing, but the reflection off of the snow can cause a lot of sunburns. Other reflective surfaces can have the same impact. Sand, water, the UV can travel through water, so people often burn from those reflective surfaces.
The thing is, as serious as its consequences can be, sunburn is so preventable.
The easy answer is sunscreen. And the reason that became the easy answer is because there's big money in sunscreens. It's probably a billion-dollar industry.
But the easiest answer isn't necessarily the best solution.
Actually, seeking shade is the best thing. Just like not sitting in the sun, trying to get into the shade when you can.
Or when shade isn't an available option,
avoiding the peak times between 10 a.m. and 2 p.m. and then covering up, wearing a wide-brimmed hat, wearing sunglasses, wearing clothing that has UPF, which is kind of like sunscreen put into the fabric. For people who don't like to wear sunscreens, there's this pill called HelioCare. It is over the counter, and it just increases the amount of time that you can be in the sun without burning. All of those things are generally easy, but I'm also a big fan of sunscreen.
So, Dr. Vaughn now gives us a quick lesson in Sunscreen 101, beginning with SPF ratings.
SPF, sun protection factor, based just on UVB. What it is how much UVB it takes to turn your skin red. And it's a mathematical equation that shows what that number is, how much sunlight of UVB you need with sunscreen divided by without sunscreen.
She gives an example.
Say that when you put the sunscreen on, then all of a sudden you need a lot more UV energy, and that can be a function of the intensity or the time. Say if it's 10 times more, then that would be like SPF 10. If it takes 30 times more energy to burn the skin with the sunscreen on than your normal unprotected skin, then that would be SPF 30.
Hey, you weren't promised no math. Besides, this is important stuff, because the fact is,
people often don't use sunscreen the right way. Some things that I advise people not to do. I don't like spray-ons. The problem with the spray is that people don't get the right amount on the skin. You need a certain density of sunscreen in order to get the SPF. And with the spray-ons, a lot of times people aren't getting that.
Another problem,
people forget some really common areas, back of the neck, top of the ears. And then the other thing about applying sunscreen is that you do have to put it on every couple of hours. It's not fun. I just encourage people, do your best. And if you do it every 3 hours, okay, fine, do your best.
Still, even doing our best, sunburn happens. And so,
when it does happen, you need to cool it down. Cool washcloth, cool compresses, cooler showers. We don't recommend that people put ice on their sunburns because people can overdo that and they get frostbite. Gently apply something to soothe the skin. My favorite is aloe vera or just a bland hydrating cream.
What you don't want to put on your sunburn?
Vaseline. I love Vaseline. I'm obsessed with Vaseline. This is the one time that you don't want Vaseline, and that's because that can actually trap heat into the skin, and you don't want that heat.
And listen up, all you peelers, pickers, and poppers.
Don't peel, pick, or pop anything. It's so tempting, and it is so satisfying to just peel that skin off. I get it, but you want to let that dead skin essentially hang on as long as possible and not peel it off. And don't pop the blisters. They're nature's Band-Aid. Try to leave it alone.
Beyond sunburns, overexposure to UV rays can lead to other more serious conditions such as skin cancer.
Skin cancer is really common. Basal cell cancer is the most common cancer in America. 1 in 5 Americans will have a skin cancer by age 70.
On the positive side,
basal cell cancer, we always say if you're going to get a skin cancer, that's the best kind to get because it generally does not spread to the rest of the body, but it can have serious consequences.
Which is why you want to watch your sun exposure this summer.
One really intense sunburn, if you're a child and you have that can double your lifetime risk of melanoma because that single intense burn, that big intense burst can cause so much damage to the cells.
Although, more typical
is that cumulative effect. Little sun here, little sun there. It's those little micro sessions of damage. When you add that up over decades, then yes, that's enough exposure to get skin cancer.
What are signs of skin cancer to look for?
There is a precancerous state, and that's these rough, gritty bumps, usually on the face, ears, and back of the hands, that don't go away. And they're not crumbly. Those ones are okay. Those are not precancerous.
To help identify a melanoma skin cancer, there's
the ABCDE of melanoma. It's the asymmetry, a mole that's different on one side than the other. It's the border. We like our moles to be nice and smooth around the edges. It's the color. So we like our moles to all be the same color. The diameter, if it's larger than a pencil eraser, that is slightly higher risk. And then the E is actually the most important, evolving, how the mole is changing over time. So again, that's the ABCDE of melanoma.
What are treatments for skin cancer?
There's some things we can tell with our eyes or with our dermatoscopes, but in general, we have to biopsy it. We remove part or all of that lesion. We send it off to our lab to look under the microscope and tell us what kind of cancer is this.
Once that's determined,
then we figure out what treatment's for you. So that might be a simple surgery. It might be a more complicated surgery. It might be a really deep surgery where we even have to check your lymph nodes, radiation. For some of the cancers, when we catch those really early, we can treat it with a cancer cream, or if we've removed all of the lesion with the biopsy, we can just monitor it.
Overexposure to the sun can also have cosmetic impacts on our skin. And while vanity is subjective, a line must be drawn at tanning beds.
There's no reason to ever go into a tanning bed. Tanning beds cause cancer. Even using a tanning bed one time increases your risk of melanoma. So a lot of societies, including American Academy of Dermatology, actively lobby against tanning beds.
Dr. Vaughn says, in preparing for summer skincare,
keep things simple. Find a sunscreen that you like. You like the way it feels on your skin. You like the price point. You like the tint of it.
Then use it.
Oh, 100%. Make it a daily habit to wear it on your face, and then every time that you go outside, wear it all over the body.
And if you have concerns about your skin health, don't rely on Dr. Google.
People should not really be taking medical advice from social media influencers or AI. Talk to your primary care doctor. They're your quarterback of your team. And then they'll decide if you need to see a board-certified dermatologist.
Take it from an expert. But now, we're all out of time for this edition of CTSI Discovery Radio. As always, thanks to each of our guests for appearing on today's show. Dr. Brian Fisher and Dr. Shola Vaughn. I hope you've discovered something by listening today. CTSI Discovery Radio airs the third Friday of every month. Join us each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you a sun-filled and safe summer. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Julie Freed.